Did you know some of the most effective medications in a veterinary hospital are ones you may never hear about by name? Have you ever left the clinic with a small, unlabeled bottle, feeling a flicker of uncertainty about what was inside? This feeling is more common than you might think. Many pet owners go home with prescriptions trusting their veterinarian completely, yet wishing they had a little more information. We are going to pull back the curtain on some of these medications. Our goal is to empower you with knowledge, not to create worry. Understanding your dog's care plan is a key part of being a great pet parent, and we believe that a well-informed owner is the best partner a veterinarian can have. That's why we're exploring some of the medications that often remain in the background, their uses, their benefits, and just as importantly, what you should watch for. This information isn't meant to replace your vet's advice but to help you ask better, more specific questions during your next visit. Your dog's health and safety are your top priorities, and that same level of care should apply to understanding their medical treatments. Medicines can heal, comfort, extend lives, manage chronic pain, and soothe anxiety. But without a full explanation, a gap can form in the circle of care. Imagine this scenario: you start your dog on a new medication for pain. A few hours later, your dog gets unusually sleepy, or even a bit wobbly on their feet. If you weren't told this was a possible and often normal side effect, you might panic. That panic could lead to a frantic, expensive emergency visit, all stemming from a simple communication gap. To bridge that gap, let's quickly touch on what happens when your dog takes a medication. This process is called pharmacokinetics, and it has 4 main stages: absorption, distribution, metabolism, and excretion, or ADME. First, absorption is how the drug gets into the bloodstream. This is where instructions like give with food or give on an empty stomach become critical. Some drugs need food to be absorbed properly, while others are absorbed faster without it. Food can also act as a protective buffer for medications that might otherwise irritate the stomach lining and cause nausea. Next is distribution, where the bloodstream carries the drug throughout the body to its target site. Then comes metabolism, where the body, primarily the liver, chemically alters the drug, preparing it to be removed. Finally, excretion is the process of eliminating the drug from the body, usually through the kidneys and into the urine. This entire ADME process influences how quickly a drug works and how long its effects last. This brings us to a key concept: a drug's half-life. This is the time it takes for the concentration of the drug in the body to be reduced by half. A drug with a short half-life is eliminated quickly and may need to be given multiple times a day. A drug with a long half-life stays in the system longer, often allowing for once-a-day dosing. Understanding this helps explain why your vet prescribes a specific dosing schedule. It's not arbitrary. It's designed to keep a steady, effective amount of the medication in your dog's system without building up to potentially harmful levels. Clear information about these processes prevents unnecessary stress and helps you monitor your dog's response accurately. Knowing that mild sedation is expected for the first few days, or that a pill might cause an upset stomach without food, transforms you from a worried bystander into a confident caregiver. With this context, knowing whether to give meds with food or on an empty stomach, understanding potential interactions with other drugs, and recognizing expected side effects, you can ensure medications are given correctly and safely. For example, if a pill is known to cause drowsiness, your vet might suggest you give it in the evening, so the effect aligns with your dog's natural sleep cycle. This simple adjustment can make a world of difference in your dog's comfort and your peace of mind. Now, let's open the veterinary medicine cabinet and take a closer look at a few lesser-known but incredibly useful drugs. These are medications you might not hear about every day, but they play a crucial role in managing complex conditions, from chronic pain to behavioral issues. Understanding how they work can transform your partnership with your vet, turning anxiety into informed action. For each drug, we'll explore its main purpose, the science behind its primary benefit, and a common side effect to watch for. This isn't just a list, it's a deep dive into the how and why behind your dog's treatment plan. First up, gabapentin. Its main use is for neuropathic pain, that's pain originating from damaged nerves. It's also frequently prescribed to reduce situational anxiety like the stress of a vet visit or a car ride. Its primary benefit is providing significant relief with a wide safety margin. It works by binding to a specific part of nerve cells, the alpha-2 delta subunit of voltage-gated calcium channels. This action effectively turns down the volume on hyperexcited nerves, reducing the transmission of pain signals. A common and expected side effect is sleepiness or sedation, and occasionally some wobbliness or ataxia, especially when starting the medication. This usually subsides as the body adjusts. Next, amantadine. This drug is a powerful ally against long-term chronic pain, particularly from conditions like severe arthritis. It targets a very specific type of pain pathway. Its benefit comes from blocking a spinal pain receptor called the NMDA receptor. This helps to interrupt a phenomenon known as wind-up pain, or central sensitization, where the nervous system becomes progressively more sensitive over time. Amantadine helps reset this hypersensitivity, restoring comfort where other pain relievers may fall short. It's almost always used as an adjunctive therapy, meaning it works alongside other medications like NSAIDs to create a more comprehensive pain management plan. A potential side effect can be gastrointestinal upset, such as vomiting or diarrhea. In rare cases, some dogs may experience agitation or restlessness. Now for mirtazapine. This is a potent appetite stimulant that also has powerful anti-nausea properties. It's a go-to for dogs undergoing chemotherapy, managing kidney disease, or recovering from surgery. Any situation where a poor appetite is a major concern. The benefit is clear. It gets a sick dog eating again, which is fundamental to recovery. It works by blocking specific serotonin receptors in the brain and gut that are involved in nausea and appetite suppression. The main side effect is drowsiness, but paradoxically, some dogs can experience hyperactivity or increased vocalization. This is why it's typically prescribed at a very low, carefully calculated dose. Finally, let's look at amitriptyline. This is an older human drug that has been repurposed in veterinary medicine for a range of behavioral issues, including separation anxiety, compulsive behaviors like tail chasing, and noise phobias. It can also play a role in managing certain types of chronic pain. As a tricyclic antidepressant, its benefit is that it helps rebalance brain chemistry for a calmer, more stable dog. It works by increasing the levels of key neurotransmitters like serotonin and norepinephrine in the brain. However, its anticholinergic properties lead to common side effects like dry mouth, which you might notice as increased drinking, as well as sleepiness and sometimes mild constipation. It's a drug that requires careful screening, especially for dogs with certain heart conditions. It's critical to remember that all of these medications require precise dosing and careful monitoring by your veterinarian. This information is not a replacement for professional veterinary advice. It's designed to empower you to ask better, more specific questions during your appointments. When used correctly, under veterinary guidance, these medications can profoundly improve a dog's quality of life. Understanding the science behind them is the first, most important step you can take as their advocate. If you found this deep dive helpful and agree that informed owners make the best partners in care, please hit that like button. Your support helps us spread this vital message to more dog lovers just like you. Now, let's discuss a medication that often raises eyebrows in veterinary care: ketamine. The name alone carries a heavy weight, and for good reason. Most people associate it with two very different, very powerful applications: as a potent general anesthetic in human operating rooms, or far more notoriously, as an illicit street drug known for its disorienting hallucinogenic effects. This dual reputation understandably causes concern for pet owners. When you hear that name, it's natural to feel a sense of alarm. But in the controlled, precise world of modern veterinary medicine, ketamine is a completely different story. It's a powerful, often misunderstood tool that, when used correctly, offers a unique and profound form of relief. The key to understanding its role in pain management is dosage. The amounts used for pain are vastly different from those used for anesthesia. We're talking about microdoses, delivered as a constant rate infusion, or CRI. This means a very small, meticulously calculated amount of the drug is administered slowly and continuously, usually through an IV line, over several hours or even days. This isn't a single large injection designed to induce unconsciousness. Instead, it's a steady, low-level administration that works on a completely different principle. At these sub-anesthetic doses, ketamine doesn't just numb pain, it fundamentally changes how the central nervous system processes it. It works by blocking specific receptors in the brain and spinal cord called NMDA receptors. When a dog suffers from severe chronic pain, these receptors can become oversensitized in a process known as central sensitization or wind-up pain. The nervous system gets stuck in a state of high alert, amplifying pain signals long after the initial injury. Ketamine effectively interrupts this vicious cycle. It acts like a reset button, calming the overactive neurons and allowing the nervous system to return to a more normal state. This makes it an invaluable option for some of the most difficult cases: severe pain from bone cancer, debilitating arthritis, or as an adjunct during and after major surgery to prevent windup from occurring in the first place. It's reserved for situations where conventional pain medications like NSAIDs and opioids are no longer enough. Because of its potency, a ketamine CRI is only ever administered in a hospital setting under constant vigilant monitoring. The veterinary team closely tracks the patient's heart rate, blood pressure, and comfort level to ensure the dose is both safe and effective. While transient side effects like mild disorientation are possible, they are carefully managed by the clinical staff. Some veterinarians may avoid using the name ketamine to prevent unnecessary alarm, but we believe transparency is crucial for building trust. Understanding and a medication is being used empowers you as a pet owner. When wielded by a skilled and knowledgeable team, a low-dose ketamine infusion is not something to fear. It is a compassionate, science-backed, and highly effective therapy that can bring profound relief to dogs suffering from excruciating, otherwise untreatable pain. We've seen how lesser-known medications can help, and why clarity is critical for pet health. Understanding names, purposes, and side effects turns you into a confident partner in care. Transparency builds trust and better health outcomes for your dog. Please subscribe, like, and share to help other pet parents. Join our monthly live Q&A to ask your questions directly and get personalized insights. Tell us your experience in the comments, and check out our next video for more essential pet care tips.